Hello, my name is Benjamin Quick, and today I'll be discussing aeromedical factors. The first thing you want to consider when looking at aeromedical factors is a medical certificate, and there are different classes. So if you want to look at Regulation 6123 in your FAR AIM, it shows, it has a graph or a chart of all three medical certificates that you can get, first, second, and third. They all have different uses. First class is mainly used for when you're conducting commercial operations, so like an ATP, for example. And for ATP, if you're using it for airline and transport pilot, then under the age of 40, it expires after 12 months. If you're over the age of 40, then it lasts 6 months. Any age when conducting an operation requiring a commercial pilot certificate, then it's 12 months. And then if you are using it to conduct operations, you needed a recreational pilot certificate, private pilot certificate, flight instructor, student pilot, or a sport pilot when they are not using their U.S. driver's license as a medical qualification. Then under 40, it is 60 months, and over 40, it is 24 months. For a second class medical certificate, if you're using it for ATP, you can only use it for the second in command privileges. So for any age for that is 12 months. And then again with the recreational pilot certificate, private, flight instructor, sport, and student, under 40 is 60 months, over 40 is 24 months. And then for a third class, it only can be used for the recreational pilot certificate, private pilot, flight instructor, sport, and student certificates. Under 40 is 60 months, and over 40 is 24 months. So definitely utilize this 6123 is the regulation, and then when you're looking at what you need a medical for. And then once you want to obtain medical, you can go to faa.gov/pilots/AME locator / and that'll take you to an AME locator on the FAA website. And that's where you can find a aviation medical examiner in your area. So once you find one, you'll be able to search that doctor and look at where their office is and what kind of services they provide. If you want to make sure, if you're going for a first class certificate, that they do offer that, or any other certificate, you want to make sure that they offer it first, especially when it comes to basic med, because some medical examiners may not offer basic med. So a quick note on basic med. So when you're looking at getting a basic med, you want to make sure that your AME is going to offer that. And you also need to have had a medical since July of 2006, and it cannot be suspended or revoked. So you would want to get a basic med certificate if you are unable to obtain a first, second, or third class medical currently. And then once you schedule an appointment, you want to make sure you bring all the necessary paperwork that they say and follow the directions on the website. So next, if you want to obtain a medical certificate in the events of a medical deficiency, you would want to consult your AME that you currently have and see what action is necessary and what the options are. They might be able to give you certain options when it comes to obtaining that medical. But in the meantime, flying is prohibited. So if you have something that, like you broke your leg or something, you won't be able to fly. Contact the federal air surgeon for specific medical test flight. And you can receive from that flight a statement of demonstrated ability. When you show the flight surgeon that you can still safely fly the aircraft, they will be able to issue that, and you will be able to legally fly. But they could also add limitations to your medical. In this next section, we'll be discussing causes, symptoms, effects, and corrective action for medical factors. The first one will be hypoxia. Hypoxia, the simplest term, is deficiency of oxygen. There are different types of hypoxia. We have hypoxic, hypemic, histotoxic, and stagnant. Hypoxia has to do with insufficient supply of oxygen to the body as a whole. This usually happens when you are at altitude, unpressurized, and you are getting an intake of less oxygen than you need to be getting. So when you're at altitude, it's not that there's less oxygen percentage in the air, but there's less pressure in the air, so that means there's less oxygen as a whole. When you're discussing hypemic hypoxia, that has to do with the blood carrying the oxygen molecules, and it is hindering that because of carbon monoxide poisoning. Histotoxic hypoxia deals with the inability of blood cells to effectively use the oxygen supplied by the blood caused by alcohol or drugs. So when you're consuming alcohol, drugs, and flying, this will can occur and will cause unsafe flight. Stagnant hypoxia has to do with the heart not pumping blood like it should, and it's not flowing efficiently. And that could be because of heart problems, but it could also be because of excessive acceleration, which happens for fighter pilots in particular. Shock or constricted blood vessels can also cause stagnant hypoxia. Some of the causes of hypoxia is unpressurized cabin above 10,000 feet without any supplemental oxygen, as well as consuming alcohol or drugs, carbon monoxide poisoning, or carbon monoxide entering the cockpit from the exhaust or anything else. And then, like I discussed, with heart problems. Some of the symptoms of hypoxia can include blue fingernails or lips, dizziness, drowsiness, headache, nausea, euphoria, and belligerence. All of these symptoms and effects can cause you to being unable to safely fly the aircraft, and the corrective action for this would be to ascend to a safe altitude if you're experiencing hypoxia, and you should not be consuming alcohol or drugs when flying. If it's carbon monoxide poisoning, you need to make sure that you are opening the vents, closing the heat, because that's where the exhaust could be coming from and entering the cockpit. Or if it's stagnant hypoxia, you want to take corrective action by not accelerating as fast, or wearing a pressure suit to help with that. Or if it's with heart problems, you need to consult a doctor. The next medical factor that I'll be discussing is hyperventilation. That's an abnormal increase in volume of air breathed into the lungs, causing excess loss of carbon dioxide. This can be caused by emotional distress such as panic, fear, or anxiety. The symptoms of hyperventilation is lightheadedness, feeling of suffocation, drowsiness, and tingling in extremities, and coolness. Some of the effects of hyperventilation is incoordination and disorientation, which can lead to unsafe flying. The corrective action for this medical issue would be to increase carbon dioxide intake, and that would be accomplished by breathing into a paper bag. That would help slow the breathing rate and be able to recover. The next medical factor that I'll be discussing is middle ear and sinus problems. So what causes middle ear and sinus problems is the differential pressure inside and outside of the eardrum and sinus cavities, causing them to swell or flex. And this could be due to respiratory sickness or infection, or sinus congestion, or an ear infection. Some symptoms of middle ear and sinus problems are aching, loss of hearing, and possibly damage to the eardrums. This would cause you to be unable to hear. It would feel blocked, and you'd have a hard time hearing, as well as popping during descent, and that could distract you from having a safe flight. Some corrective action: you can pinch your nose and lightly try to blow out of your nose, and that will push air through the eustachian tube into the middle ear and help get rid of that pressure. The next medical factor is spatial disorientation. And it is a lack of orientation with regard to the position, attitude, or movement of the airplane in space. So the causes of this is the brain receiving conflicting signals from visual and kinesthetic senses. This results in symptoms of confusion and dizziness, and affects you to be unable to safely control the aircraft. Corrective action for spatial disorientation is to focus on the instruments, especially in IMC, making sure that you're trusting the instruments and following them, and that'll help you conduct a safe flight. And also recognizing the illusions and what to expect from them so that you can make sure that you're doing the correct procedure. Within spatial disorientation, there are illusions that you can get from different systems such as vestibular, visual, or optical. So within the vestibular section, you can get the Leans, Coriolis illusion, graveyard spiral, somatogravic, inversion, and elevator illusions. Within the visual section, you can get a false horizon or autokinesis. Optical illusions consist of a runway width illusion, runway and terrain slope illusion, featureless terrain illusion, water refraction, haze, fog, and ground lighting illusion. Some of the ways that you can prevent these illusions taking over and creating an unsafe environment, you can make sure that you are checking the weather and making sure that you're not going to be flying into known IMC conditions when you're not instrument rated. And you can also prepare for the illusions like the upslope illusion, know what it is and what it makes you think that you're doing, and be able to take corrective action for that. The next medical factor that I'll be discussing is motion sickness, also known as air sickness. And this is caused when the brain is receiving mixed signals about the state of the body. The symptoms of air sickness or motion sickness is general discomfort, nausea, dizziness, paleness, sweating, and vomiting. The effect of this is you are unable to safely control the aircraft because you are focused on not feeling well, which can distract you from flying the aircraft. Actively throwing up obviously will distract you from flying. So some corrective action for when you get motion sickness or air sickness is to open air vents, loosen clothing, use oxygen if it is available, and avoid unnecessary head movements. So just making sure you remain calm and letting yourself cool down and relax will be the best thing that you can do for that. Up next is carbon monoxide poisoning. It is colorless and odorless, and it causes an excess of carbon monoxide in the blood and can come from an exhaust leak in the cockpit. So typically when we're flying small general aviation aircraft, the heat that we get for the cabin comes it's the heat provided from the exhaust. So if there's a leak within that, exhaust can enter the cockpit and cause carbon monoxide poisoning. The symptoms of carbon monoxide poisoning is headache, blurred vision, dizziness, drowsiness, and loss of muscle power, and eventually death if nothing has taken place to correct that action. The effect of this is not being able to safely fly the aircraft because of the symptoms. You'll not be able to fly when you're feeling super dizzy or drowsy. Some corrective action for carbon monoxide poisoning is that you can turn off the heater and just suffer in the cold. That's completely fine. Obviously safety is number one, so you'd rather be a little cold than ingesting carbon monoxide, which can lead to death. Opening fresh air vents, so getting fresh air into the cockpit from outside is key. And using supplemental oxygen if you have any. If you have any, that would be great. and that would help prevent any further symptoms from carbon monoxide. The next medical factor is fatigue and stress. For stress, there are two types, acute and chronic. Acute stress deals with an immediate threat in your life, and which causes you to be stressful. Chronic stress is long-term stress or accumulated stress that is building up over time. And this can cause you to be distracted from making safe aeronautical decision making. For fatigue, there is acute fatigue and chronic fatigue. For acute fatigue, it is short-term exhaustion, whereas for chronic fatigue, it is long-term exhaustion. So this is, fatigue is another level of being tired. Acute fatigue is closer to being just like a little tired, but chronic fatigue has to deal with truly being exhausted for a long period of time, and it can cause some very poor decision making. So the symptoms are feeling tired, which affects your body, and stress also affects your body in negative ways that can hinder your ability to safely control the aircraft and make improper aeronautical decision-making decisions. And corrective action for this is to not fly in the first place after you've gone through your I'm safe checklist, your illness, medication, alcohol, fatigue, external pressures checklist, and this will help prevent anything that could be dangerous to flight. And also getting more sleep if feeling fatigued is important, catching up on sleep, and also learning to deal with stress and knowing how it affects you and how you can mitigate those effects of stress. The last medical factor is dehydration, lack of water, lack of H2O. So this can be caused by hot flight deck, hot flight line, wind, humidity, and drinks such as coffee, tea, alcohol, and caffeinated soft drinks. Those all make you dehydrated, and it's important to drink water in preparation for flying ahead of time. So the symptoms are headaches, fatigue, cramps, sleepiness, and dizziness, and it affects you mentally and physically, and performance is difficult at that point of dehydration. And corrective action, like I said beforehand, is making sure that you're drinking enough water and being safe, and avoiding those drinks I mentioned before, and heat. You want to make sure that you're in a cool environment leading up to your flight. You don't want to be outside for hours and hours without any water, and just make sure that you're intaking enough water. And if you are dehydrated, then you need to drink water to help recover from that dehydration state. The effects alcohol and drugs has on flying is very crucial. It affects your mind and body in a negative way. It impairs your reaction time and decision making to safely control the aircraft. For alcohol, a good rule of thumb is 8 hours bottled throttle. The regulation states 8, but a safe amount of time would be 12 to 24 hours. And everyone is different in how alcohol affects your body, so you need to make sure you know how it affects your body before stepping into the cockpit. The minimum blood alcohol content is 0.04%. If it's anything above that, that would be considered illegal, and you would be facing criminal charges if you are attempting to fly or have already been flying. For drugs, for illegal drugs, it is never acceptable to be ingesting those. And when it comes to prescription drugs, you need to consult your AME to make sure that it is safe to use while flying. And if it isn't, then you need to notify your company if you are flying for a company, or if you're flying for leisure, just don't fly. It is not safe and illegal. So the last thing I would be discussing today is the effect of nitrogen excess. So this is caused when you are scuba diving. the body it has an increase in pressure, which allows for the nitrogen to dissolve in the body tissue and fluids. It will lead to decompression sickness when you are flying at altitude. So if the nitrogen is forced to leave the solution too rapidly, bubbles form in different areas of the body, causing a variety of signs of symptoms. A common symptom is joint pain, and this is when you are flying at altitude right after scuba diving. So the safe wait times that is suggested is that below 8,000 MSL, 24 hours after a controlled dive and 12 hours after an uncontrolled dive. And above 8,000 feet MSL, if you're flying at 8,000 feet above MSL, it is 24 hours for both uncontrolled and controlled dives. Thanks for listening to my Aeromedical Factors lesson, and I wish you all the best and have a good one.